What's going on, guys? Welcome to another episode of Healthspan Academy. I am your host, Craig Shearhart, and joining me today is Dr. Kirsten Perley, who's a naturopathic doctor. And she started her academic career at the Bachelor of Science in Nursing from McMasters, and then went on to complete a doctorate in Naturopathic Medicine at the Canadian College of Naturopathic Medicine. She's got 14 years of experience as a registered nurse in labor and delivery at North York General Hospital in Toronto, 15 years of experience as a naturopathic doctor at Remedy Health Center. And she's a practitioner in frequency-specific microcurrent, which is our topic for today. So we're going to get into that and how that can essentially help relieve certain clinical issues in our overall function. Kirsten, thanks so much for joining me today.
Thanks for having me. I'm excited to be here.
Awesome. So I want to kick this off with how you got started in naturopathic medicine. Is that something you kind of always had an interest in? Did you get treatment in that area and kind of like piqued your interest, or how did that all kind of unfold?
Yeah, so it's originally, going to McMasters, it's the School of Evidence-Based Medicine, right? So I was doing my nursing degree, and I was fully in love with randomized controlled trials, and really thought I was probably going to do a PhD in nurse research and nursing research. Yeah. And then in my fourth year, I've been dealing with some chronic health issues. So gut issues, fatigue, crushing fatigue, barely made it to a morning class, insomnia, like all sorts of things. And so then my mom there was somebody who did, a naturopathic doctor who did a presentation at a workplace. And my mom said, well, why don't you try that? And I was like, oh my gosh, Mom, like that's super lame. Like I'm not doing that. And I was rolling my eyes, and she said, well, you've done everything your way. You've done everything, that way. So why don't you try something different? Yeah. So I very begrudgingly went to the visit. I was super skeptical, but I was desperate. So I took her recommendations that she said. And then in 6 weeks, I was 50% better. Wow. And then in 3 months, I was 90% better.
That's amazing.
It's always that last 10% that takes like kind of the longest to resolve. But
yeah.
So then by that point, I was telling everybody, like, they're like, oh, I have this problem. I'm like, you should go see a naturopathic doctor. Yeah. So I became the poster child of recommending naturopathic medicine to everybody who would listen. Yeah. Awesome. But the moment that I decided to go into, to actually learn about it was after I was just there for a regular, health promotion visit, and I was coming down with influenza.
Yikes.
That moment when you're getting the shaking chills of a fever coming on. Yeah. And you're like, I'm about to go down hard. And like, you're like, oh God, what's this going to look like? Yeah. And, she said, okay, these are the things you're going to take. This is how you're going to manage your fever, not pharmaceutically. You're going to manage it with these homeopathic remedies. Cool. And then I was better in 2 to 3 days. Oh, wow. So which was not my norm, right? My norm would have been that I would have been out for a long time. So that piqued my curiosity. I was like, what? Like, how did that happen? Because there were a lot of other staff members who were out for 2 to 3 weeks with that flu. It was a particularly bad influenza year. So that was where I decided I couldn't really live without learning what she had done. Yeah, fair enough. Yeah. Let's figure out how all this managed to fix. How does it work? What's this alternative that we don't know about? Yeah.
Yeah. I love that. So, and at some point you got interested in frequency-specific microcurrent, which I've kind of been dabbling a little bit in resonance therapy, but I guess the premise is that you're applying these paired frequencies with a small voltage around tissues, and it's relieved a lot of tissues. And from the little bit that I've read on it, it's been kind of like almost like a last ditch effort for some people that have tried just about everything else, and it's been kind of it's relieved all kinds of issues. So talk about how you got interested in that and what we know about it, and basically how it works.
So when I've been in practice long enough that what I've always noticed from the beginning is if I can have a response of people's parasympathetic nervous system, then their body can start to heal itself. Right. But I have to get them to parasympathetic. Yeah. And what I noticed around 2016 was I couldn't get people into parasympathetic. And like, this was before the pandemic, right? Right. Now it's like even worse. Yeah. They're just overstimulated, overstressed, and just can't settle down. Cortisol's through the roof, vagus nerve is off, all those things. So what I noticed was I was having to put on more and more things to fix the gut, more and more, their protocols went from maybe 2, 3, 4, maybe max 5 things to like having a sheet full of 10 recommendations. Wow. So that, again, it was like curiosity, like what else could I be using to have an entry point to the nervous system? And so I spent some time researching, and then I came upon FSM because there's frequencies that impact the brain.
Mm-hmm.
So I was sold as soon as I heard that, and then I started training in it. And basically, it is these paired frequencies. You have one frequency that works on the condition. So like what's happening? Is it inflamed? Is it fibrosed? Is it scarred? Is it congested? And then a second pairing that works on the actual organ or tissue.
Right. So one is the application, one is the location.
Yeah.
Very cool. So talk through some of the, obviously we're not getting into any specific details of clients in terms of privacy and stuff like that. But what are some of the issues that you've had good success with in terms of using FSM?
I mean, there's so many things. It works really well for disc pain and nerve pain, which are two areas that are typically, difficult to treat. So I've had patients who come in with, either like an acute aggravation of a disc or a new disc, and their pain is 10 on 10, and within the course of the visit, it goes down to either a 1 or a 0, like it's just gone. So that's pretty spectacular.
Yeah, that's wild.
Yeah. Neuropathic pain. So, I've had patients I've had a few patients like this where they have osteophytic lesions in the neuroforamina. And so the nerves are being compressed by the osteophytes. And now it takes, a period of time, we're looking closer at 6 months of regular use. And for those patients, they usually buy a machine, but they can actually dissolve those lesions so that neuropathic pain can be fixed. And I have a number of clients that we've done that with.
That's wild.
PTSD, it's really effective for PTSD. I think you had mentioned you'd read Carolyn McMakin's book, Dr. McMakin's book.
Yeah.
I'm not sure if she shares any PTSD cases in that. But that's one where, we see kind of like their scores on their PCL. I think it's called the PCL-5 for civilians.
As you're talking this through, I think I do remember at least 1 or 2 clinical cases that she goes through with PTSD. There's a whole range of stuff, which is very cool.
Yeah. So you can take, I've had patients, like I just recently had somebody where their score was like, there's different ways to score it, whether you're just scoring the categories or you're giving like a number to the score. And I kind of do both for my clinical notes, but, the score was like 85 out of a possible 90. And within 4 weeks, she was down to a 12.
Wow. That's incredible.
So that's amazing to see. And then also with depression, we see really good results with depression as well. Usually depression is, it's a brain thing, but it's also it's predominantly a gut thing. So I'm treating both the gut with frequency and the brain with frequency to do that. Yeah.
They're so tightly related. That's once you fix one, often it fixes the other. Yeah.
Well, the vagus nerve is actually 80% afferent fibers from the gut. So if you're not treating the gut in depression, you're probably not going to see results that you want to see. It's just not happening just in the brain. And of course, all of our serotonin. Used it for shingles. That's and I know Carolyn shares about that in the book. So I've had a couple cases of ophthalmic branch shingles, which is a really dangerous type of shingles to have because that can go into the eye and cause blindness. So that has worked really well. I do a lot of chronic stuff. So people who are coming with chronic infection. So it's worked really well for chronic Epstein-Barr virus, which, as an aside has, in the research been shown to be part of the reason, part of the problem for long COVID symptoms is often reactivated Epstein-Barr virus. So that's been really working well. And then, I guess something I think just because of my background in labor and delivery, I have always seen a lot of babies. And I learned to do craniosacral 15 years ago, like before I became an ND.
Oh, cool.
So I've combined craniosacral with frequency. So if there's been a traumatic birth with forceps, vacuum, cesarean section, or even just if they've had a prolonged birth, and it's impacted the skull bones, frequency works really, really well on Dura.
Very cool.
Yeah. So
you mentioned the challenge of getting people into parasympathetic state before we do that. Do you find that this is kind of a workaround, or does this help people get into a parasympathetic state? Or do we know that? Do you have a sense of like, is their heart rate starting to drop as they get into these frequencies, or how does that kind of relate?
Yeah, I mean, so from some of the studies that Carolyn has done, we know that, like on the physiological level, that there's a lowering of interleukin-1, interleukin-6, TNF alpha.
Mm-hmm.
So decreasing that inflammation response, which is one of the reasons why the vagus nerve would be off in the first place. Right. It increases endorphins. So people often will be very like, most people get into a Dorf state where they feel very relaxed. So their heart rate does drop. Right. I've had a couple of long COVID patients who are coming in on with pulse oxes, and their pulse ox increases. They're able to breathe deeper, it also increases ATP in the cells by up to 500%. So, so from a mitochondrial perspective, it's like the cell kind of turns on, right? Yeah. So if they're stuck in a sympathetic state, it's like you have to kind of calm the sympathetics first, right? Yeah, and then increase the parasympathetic tone. But I find I actually don't generally have to support the parasympathetic just by telling the body, giving it a safety signal, like you're safe, right? Where people have been walking around feeling completely unsafe for the last 2.5 years. Yeah.
That's absolutely wild. I hadn't heard those numbers about the mitochondrial function. That's very cool. It's, and you can see that because you watch things change so quickly, like the tissue changes so quickly. So typically within, if you're on the right frequency, because there's a bit of detective work, you got to do your diagnosis, and then you got to play around sometimes because sometimes you think it's going to be, one thing, and then you don't feel a tissue response. Yeah. So, if we get too focused on the diagnosis that they came in with, for instance, like, they're like, it's this problem. And then, you're like, okay, well, and then you run that frequency for that diagnosed problem, and it doesn't have an impact. Yeah. Right. So then you gotta, you gotta make your own. To the root issue. Unravel it. Yeah. Fair enough. Yeah. So in the book, she talks about some sports injury recovery, and I guess this probably, I assume it's connected into the deals with inflammation. Have you treated some sports injuries with this and sports performance and rehab and that kind of work with it?
Yeah. So, I mean, I'm not treating huge amounts of athletes other than my oldest son who plays football. So, but I am treating, and he appreciates that. Yeah. Well, he's, things like DOMs, like you don't actually have to have DOMs. Yeah. So I know there's a lot of people who are going to jump in an ice bath for that. I'd say frequency is a much gentler process, but he's not going to use it for every workout. But if it's been a training camp, he's going to run that protocol. Yeah. Sometimes people will say like, oh my God, like, how are you back to training and feeling good? Like you're walking, like it was leg day yesterday, but you're walking fine. And he says, it's my genetics. Yeah. Has nothing to do with my mom being a naturopath and an expert in FSM. No relation whatsoever. Yeah. And he has one friend who knows about it. And he's like, it's your mom's machine. Like, don't be stop trying to get all the glory. Yeah. But I do hilarious. Use it. But I do use it for if I have, a lot of weekend warriors or patients who, they're runners, and, I can think of a few cases where patients have, they don't have arches in their feet, for instance, right? So they're running, but it's throwing off everything in their pelvis. Sure. So the pelvis is unstable because they don't have arches, and they wear their orthotics, but as soon as they're out of those orthotics, they still don't have an arch. So those intrinsic foot muscles at some point got turned off. Yeah. Right? The connection from the brain. It's not that there's a nerve problem. Like there's no conduction issue. If you were to take them for nerve studies, they'd have all the connection. But the brain kind of at some point said, this is uncomfortable. Yeah. And I don't want to move it. Right. So I'm just going to shut it off. Yeah. Because the body's really smart that way. It'll inhibit a muscle if it hurts to move something. Yeah. So there's actually, I took the sports course with Kim Pettis in the States, and she has the protocol that we learned through her that basically increases the function of the motor cortex in the brain, so that you can then do the exercise, and then the brain goes, oh yeah, I can move that part. Yeah. So you can rebuild. So I've had patients where we rebuild their arches. They go from a completely flat foot to a rebuilt arch, and then that's very cool. Yeah. So those are saving all that orthotic money. Right. Yeah. And then there's I'm trying to think of other things. Like a big thing that I do, again, seeing a number of women would be the transverse abdominis after birth. Right. It's just ripped to shreds. It's not working, right? Like, and but at the same time, there was like 9 months of their body telling them, don't contract that muscle.
Mm-hmm.
And so then, they're like, oh, I have this back pain, and they can go and do, Pilates or what have you, but they're usually doing it incorrectly. There's usually tenting of the rectus abdominis muscles. Mm-hmm. And they're doing these advanced movements that are, that they really shouldn't be doing because they haven't rehabbed like the basics. So you can get that transverse abdominis firing kind of within, I don't know, a couple minutes.
That's amazing.
And then they get the feedback with their brain's like, oh, I'm actually contracting it, because it's really frustrating for them when, they're trying to contract that muscle and they're using all the cueing, but nothing's happening. Yeah. And so like I used to do that rehab before FSM with women. Mm-hmm. And it was like, you could see like, they're like, am I doing it right? And all you're feeling is like psoas is contracting, obliques are contracting. They've got tenting of the rectus, and the transverse abdominis, like I don't even exist. Yeah.
I've had that technique used just with a TENS machine. So I assume it's similar to that, where you're just stimulating the muscle to like start building some kind of like connecting to the voltage to create contractions. Is it kind of parallel to that?
I think it's different because you're not actually stimming the muscle, you're stimming the brain. So you're, and I don't know, because I haven't used TENS for that application. Yeah. But you're using a frequency that works on improving the function of the motor cortex. Mm-hmm. And then the motor cortex is just sending that signal to the muscle for them. And then they can do the movement and the muscle contracts. Yeah. With TENS, like it depletes the ATP. Like if there's a contraction, like I know when TENS is being used for people who have like, trigger point pain, it actually decreases the ATP and the muscle kind of relaxes as a result of having no more energy, whereas frequency is increasing the ATP, so increasing the improvement and like the ability to heal for the cell to heal. Yeah.
Very cool. So you, again, kind of reverting back to the issue with parasympathetic state, kind of like my light bulb goes into like lifestyle habits to let us get there. Stuff like exercise, nutrition, meditation, sleep. If you're like prescribed, or you say you're treating someone with FSM, what are the key lifestyle habits you kind of get them to take home with them to kind of like get the most out of the treatments?
Yeah. So I'm always giving like treatment plans on top of their FSM treatment, unless I'm in the case where sometimes I'm the secondary ND, like I'm using the FSM treatment and they have somebody else who's prescribing those treatments. Yeah. And I'm basing my treatment plans on a therapeutic order that includes kind of treating all the things that could be turning the vagus nerve off. Right. So, do they have like a chronic infection? Those are really common, whether it's Epstein-Barr or, a Lyme co-infection, something like that. And then we're turning on the vagus nerve with the FSM. And then when they go home, they're able to be like, I kind of coach them through body awareness. So how does this feel in their body? Because for a lot of times, like that vagus nerve might've been off since they were born. Yeah. Right. If there was a birth, like I have patients where, when they have really extreme anxiety or, ADHD as an adult, when we go back in their history, usually there's some event that happened when they were younger.
So it can completely shut off, like literally not fire at all, or just gets like muted.
Yeah, it's not that, like, obviously it has to be on to a certain extent, but you'll see like evidence of that shut off, right? Like, the babies that have reflux, why do they have reflux? Well, they have reflux because their stomach, because it's not digesting, right? The vagus nerve is not in a rest and digest, right? So they reflux. They're still alive. Their heart rate is, their heart is still beating, their lungs are still breathing. Yeah. Digestion is moving, but it's not great, and then if the reflux isn't fixed like early on, then you move to a state of, they have chronic constipation, and then they're on PEG forever, which then causes other problems. And then, and then maybe they have eczema, and then they have asthma, and then, they get a little older and now they have ADHD, and then they get a little older and now they have anxiety, right? Like it's kind of how I see that spectrum. Yeah. And so it's just not functioning the way it should be, Gotcha. And, so I'm looking at like, what's the original, like I want to find in the history, what's the original thing that made the vagus nerve not function well.
Right.
Might be a better way to put it. I'm sure somebody who's really specific with anatomy would be like, you can't say that, but let's just say they're in a state of sympathetic dominance all the time, right? Yeah. And they don't have very much sympathetic tone or parasympathetic tone. So I'm looking for that in the history. And then so it's like that body awareness, because then oftentimes when people are relaxed, if they've been in sympathetic dominance for a really long time, having relaxation, their brain starts to send them warning signals. Like, you're clearly
this is not normal.
Something.
Yeah.
This is clear. Like, the amygdala starts firing and it's saying like, dude, you're missing something. Yeah. Like, you need to pay attention because you're relaxed, but your cortisol is still high. So there's a process of like, you've gotten them into relaxation in that visit, but the cortisol is still high. So they're still getting like, the amygdala is like saying, oh my gosh, there's something going on. Right. And then the hippocampus is like, okay, I don't know. I'll think of a memory that's really distressing or create a thought that's really distressing to bring you back up into sympathetic.
Right.
So I kind of teach them that. That's a big thing that I say, like, when that happens, because it's going to happen.
Starting with the awareness.
Yes.
Yeah.
Yeah. Start with the awareness. Go, oh, there's my brain doing what all brains do when it's not used to being relaxed. Yeah. So that's a huge part of like,
isn't that wild that that's a response that we have? Like, we're so used to being wound up and sympathetic. And as soon as we calm down, the brain's like, well, no, this is not right. Something's wrong.
Totally.
Life can't be this low stress.
Like, something is, you've missed something. I know, like that for me is that. So that piece for people I find is like a huge piece. And so it's practicing, like, first it starts with awareness. Right. And then it's practicing it, like, because the immediate response then in their nervous system is to say, oh my gosh, like, I've missed something. So then they start to feel anxious. Right. And then when they feel the anxiety, the next thing that happens in the brain is they're like, great, I feel anxiety again. I suck. Yeah. I'm just like the worst person ever.
And then it's easy to blame the treatment, right? Oh, I guess this doesn't work, right? It's all, there's so many layers. So you have, like, I think making people aware of that awareness thing and like kind of feeling out what is it that they need. Is it breath work? Is it meditation? Is it their nutrition? Like, is it just literally how they're framing their stress around their life or that kind of stuff? And you're juggling a lot of variables there.
Yeah, I think people usually recognize it's more that they are out in the world and then they're like, oh my gosh, like, why can't I function in the world? Yeah. So they'll be like, oh, I felt so good during the treatment, but now I don't feel good. And so it's like a practice. So there's that mind, like that just body awareness practice. And then sometimes I'll have them listen to, solfeggio frequencies. If they're particularly anxious, to kind of get them into a calmer state. Listen to that at bedtime. I find that works really well for some of the insomnia. And then I'm also, I'm still looking at, like, sometimes people, like, sometimes it's like, again, why are they going into sympathetic? Is it a toxin, right? Like, what turns off the vagus? It's trauma, infection, stress, and toxins, right? So decrease their toxic burden and their exposure, not using like super like fragrance products, things like that. Like those can be a danger sign to the nervous system.
Right. Fair enough. Awesome. So that, I'm curious to hear like so that's kind of like the sick end of the spectrum. I'm thinking like on the other end of the spectrum, are you starting to get an interest, or is there data on, I shouldn't say is there data, it's probably not, but people that are interested in using this, not to kind of go from average to above cognitive function? Like, do you see applications like that? Do you see people coming in asking for this to kind of like get some of the cognitive benefits when they're not necessarily quote unquote sick?
Right. Yeah, I would say I probably see the higher trauma end of the spectrum, but in like regular life, like if like we have a very simple protocol called the brain fog protocol, right? So I've used it on family members if they're a bit scattered. Yeah. Just be like, you know what, put this on. Yeah. And their cognition improves, right? Huh. So I've done that with my mom and with my kids, if they're like before they have a test, they're gonna run that so that they optimize it. Huh. And really, because we know the impact that frequency has on inflammation, then really any process that's coming from an inflammation, background, right? So, then that's going to impact like that cognition. And I would say that, so, and then also there's just the cortisol response, right? So high cortisol makes us cloudy.
Mm-hmm.
So, we're always doing other things to address the cortisol, but frequency can be used to kind of because it puts you into parasympathetic, and over time your cortisol becomes regulated.
Right.
Because one of the biggest things that people have with high cortisol is they come in and they're like, I can't think, I think it's my memory.
Yeah.
But really it's the cortisol making their memory, giving them memory challenges.
Right.
Because it would make sense that if you're running from a bear, you wouldn't want to remember running from the bear.
Yeah. Yeah.
But we're literally running from a bear every day of our lives in our current, like this go, and the impacts of,
insane.
like our phones, right? Like those are causing stress response.
For sure. Just way overstimulated. It's just, So to me, that's really exciting, because I feel like for like a longevity enthusiast, we're probably getting better at like stem cell. We get to some point where we can place organs, but I feel like the brain is going to be the last piece that we can ever like engineer, right? So the longer we can preserve cognitive function, I think like that's going to be a game changer for a lot of people that are in the biohacking world, so to speak. So in kind of steamrolling on that, have you had people inquire? Are you able to treat on yourself like FSM, or like where's the, are there borders between self-care? Are there machines people can get for home use? Or what do you recommend for people that ask about that?
Yeah. So, I mean, for myself, I probably treat myself every single day with frequency. I just
really?
feel better. Right? And it's not like, it's more about like, it is about staying kind of in that optimum state. And for me, like the nervous system is kind of everything, right? Yeah. So if my nervous system does get dysregulated, I'm going to treat that kind of right away. But then I do like other programs that just like support the body. So, I run programs to support my liver, support kidneys, support the lymphatic drainage, things like that. So those kind of be my basics. And like, there's some protocols I might just run once a month. Right. And there's some protocols I might run like a couple times a week. But I'm usually doing some sort of frequency treatment kind of every now. And I run it through PMF converters, so I can sleep with it, because I don't really have time to treat myself during the day. Yeah. So I can kind of set a device, put the PMF frequency converters like that it converts the microcurrent to PMF device. And then the difference between that and a PMF mat would be that a PMF mat is not specific, right?
Do you think that's like improved your sensitivity to kind of like your normal bodily functions? And when something feels off, the fact that you're doing this, that you're kind of like, oh, does this feel off? Let's try this frequency. Is that kind of like, have you noticed those type of changes?
Yeah. I mean, I've always been really intuitive and like kind of felt energy like before that, but I think it makes me more, perhaps intolerant to like just not putting myself in like, maybe like things like, for instance, what I consume from watching, like, right. I'm like, I'm just not going to watch that. Like, I don't really watch very little TV anymore, because it's like, you feel like when you watch it with body awareness, you can feel yourself getting tense. If you're watching, some sort of like thriller or something. It's true. Like, I don't think this is good for me. Yeah. So like,
it's
and
so
then
damn entertaining. Can't stop watching Ozark. It's just too good.
Yeah, there's something, I mean, but the thing, what I do now is actually, if I do watch something where I know it's causing a sympathetic response, I will actually, like, I can feel it happening. And then I can actually like, just be like, oh, you're getting a bit like out of regulation here. Like, take a few deep breaths and like calm that response down. Yeah. And then like, cause I do think that has a massive impact, on our cortisol levels, and like, I sleep amazing. Like, I just, I go to bed, I sleep for 8 hours, I wake up, feel good. And I hear a lot of people don't do that. So so there's things like that from a care perspective. I think like that's doing something. Yeah, for sure.
I feel like it's kind of it could be a hypochondriac's nightmare. They're just like, oh, my nerve, now my ankle, now my kidney, now my liver. But I think once you get like, when you're in tune and sensitive to it, and you're applying it right, and you're like, I think also when you're spend more time in the parasympathetic state, when your rational brain's in full function, it's really cool. I'm really excited about this, kind of the potential with this.
Yeah.
On the flip end of the spectrum, are there risks? Are there people that shouldn't be doing this? What are the limitations of FSM based on what we know about it at this point?
Yeah. So, I mean, it's obviously not going to work for every single condition, but it is, as one of my, colleagues said, they're like, I think this is pretty close to a silver bullet as you're going to get in terms of like all encompassing, like, so it works on so many different things.
Right.
So there's things like, again, like I spoke about infections, like if somebody has like, we know they have an infection, and that we're not going to run, like there's a specific frequency pairing we wouldn't run because it decreases the inflammation so significantly. And the only thing that might be holding back that infection is inflammation, right? So if somebody had cellulitis, you wouldn't run that because, the only thing that's keeping it back is the inflammation, things like that. Or again, I gave the example of Lyme infection. I would tread very carefully before, again, depending on whether they're on antimicrobials or antibiotics. So there's that. But sometimes it's helpful because some people have like a stealth infection. You don't know what's there. And they're not getting treatment for it. And I actually haven't had this happen in practice, but it's something that Carolyn describes. And then all of a sudden they start to have pain in a tooth, and then they go and get an x-ray and they need that tooth pulled. Right. So sometimes there can be some, but that's, again, they didn't know they had the infection. Right. We don't use it in pregnancy, not because there's any studies that show it's been harmful, but I think it's out of the, kind of abundance of caution, and pregnant women can't even have protein shakes because they're, listed as unsafe. Right. So I think that we don't know. Right. The hypothesis there is that maybe it could change because it puts you in such a parasympathetic state, because it does increase endorphins. Could you change the way the brain was wired in the fetus if you were running frequency all the time? Oh, right. Yeah. Like, could you be wiring them into into a different state? And I think that would be, I mean, if we could ever study that would be amazing, because I would argue that most babies are being wired into a sympathetic high cortisol state. Yeah, I'm sure they're impacted by their state of their mothers, right? In some aspects. Well, they are, and the research there is pretty significant, right? High cortisol in pregnancy leads to more learning disabilities and ADHD. Sure. But we don't know. So, I'm not going to be the person to try that out. I'm going to leave that. Leave that to someone else. Fair enough. Exactly. Awesome. Yeah. Kirsten, talk to me a little bit more about your current services plans for the rest of the year in your clinic. Who is your kind of ideal client? What does that look like these days? Yeah, so I'm busy seeing patients one-to-one, and I'm trying to figure out some strategies for maybe like how I can employ some of the trauma specific work that I do for patients into kind of a group based care model to help a little bit with the wait list. I'm still trying to figure out how that's going to kind of come to pass, and how I'm going to run that. But I know that I'm working on it. Yeah. I have also, a couple weeks ago, I delivered for the first time a course that I do for naturopathic doctors on approaches to treating complex chronic patients, looking at the structural basis for why vagus nerve would be turned off, and then like our specific protocols. And I did that course with my colleague, Dr. Jessie Pierce, who's a naturopathic doctor as well. Cool. So we're probably going to deliver that again in the fall. Awesome. And so that feels like enough and already in terms of busyness as I think about it. And I'm definitely going to take a little time off, because I think during the pandemic, I just worked too much because you're bored. So it was like, I'll just work a little more. Yeah. So I'm going to take a little more time for vacation. And and then I'm not sure if I answered all the questions. Did I miss one there? Yeah, no, that's good. Yeah. Yeah. Awesome. Kirsten, I want to shift into your own kind of personal stuff. We talked a little bit about how you've been treating yourself, I guess, with FSM and having good results with that. What is at the top of your list in terms of your health priority? We're talking like cognitive function with gut health. Where is your top priority with your health, and what do your habits look like around that these days? Yeah. So as I've kind of already mentioned before, top priority is definitely, that nervous system regulation. Yeah. That's huge, because I do think that everything else improves as a result of that, right? You can't have good digestion if you're not regulated there. So that's a huge priority. I usually do, a few meditations a week. And I, I walk every morning in nature with my dog. So
Awesome.
that's always that. And that's kind of where I just take time to like connect to, figure out my thoughts, use my intuition. And that kind of starts my day every day. I do, some Pilates on a couple times a week. And then, it's hydration is really important because with frequency that uses a lot of hydration. And then, just for me and my own genetics, I intermittent fast. That's the best way for me to eat. So that's I think you just get used to it after a while and doesn't become such a thing. But people, I know there's a lot of, don't fast, but that's what works for me and my genetics. And then, the usual basic naturopathic stuff, I guess sometimes I, just take it for granted and like, eat your vegetables, have protein, don't eat gluten. Gluten's a big one for me, so I avoid that as well. Yeah.
Same. Yeah. Awesome. Well, Kirsten, has been an unbelievable chat. What's the best place for people to learn more about your work and your services?
So my website is www.drkirstenperleynd.com. Instagram is, at drkirsten.perleynd. And
awesome.
And that's about it.
Sweet. Well, we'll link to that stuff in the show notes. Thanks again for the time. It was awesome chatting.
Thank you.
Awesome. Well, thanks for tuning in this episode of Healthspan Academy, guys. We'll see you next time. Hey, what's up, guys? Thanks for tuning in today. Hope you enjoyed the episode. Thank you so much for supporting this channel. This has been a fun project. We're growing in viewership every single week, and we obviously couldn't do that without you. So thank you for continuing to tune in. I really hope you're getting value out of the programming and the content. Just wanted to give you a heads up. I've been working on a book on health and longevity the last couple of years, been collaborating with my colleague, Dr. Dan Vitale, who's an expert in the field as well. And we've basically just kind of summarized the literature, some of the techniques that we found really useful in the world of biohacking, what our exercise regimen looks like, what's, cardio type stuff is going to help us live longer and healthier, mobility work, nutrition. We've covered the whole spectrum, everything that you can basically be in control of in your health and fitness kind of moving forward to help you live as healthily as possible for as long as possible. And it's available free for download. So if you click on the YouTube banner, you'll see a link to download the blueprint. It's also on our Instagram profile or on the website. You can click on 5pillarmethod.com/optimize to get your free copy of the book. And I hope you enjoy it. Hope you're keeping well. Thanks again for tuning in, and we'll see you next time.